Welcome to the Lost Video Instruction Classroom. Today, you're going to learn some very important tips, tricks, and techniques that will help you out there in the field. First, we'll begin with showing you some basic information that will help you check vitals, resuscitate patients, and save lives. One of the most important vital signs to assess is blood pressure. This measurement tells you how hard the heart is working to pump blood throughout the body. Normal blood pressure for an adult is typically 120/80 millimeters of mercury. However, it's important to note that blood pressure can vary depending on a variety of factors such as age, gender, and medical history. Another vital sign to assess is heart rate, which is typically measured in beats per minute. Normal heart rate for an adult is typically between 60 and 100 beats per minute. Knowing which bandages are appropriate for wounds can be key to keeping your patient alive. Refer to this chart when determining which bandages to apply. Remember, more is always better. Cardiac arrest can happen at any time. It's important for paramedics to know how to respond quickly and effectively. When responding to a cardiac arrest emergency, the first step is to assess the patient's vital signs. Check the patient's heart rate and blood pressure to determine their condition. CPR is a crucial technique that can help keep blood flowing to the patient's vital organs until a defibrillator can be used. Perform chest compressions at a rate of 100 to 120 beats per minute. Once prepared, defibrillation is a technique that uses an electric shock to help restore the heart's normal rhythm. It uses defibrillators to deliver a shock of 100 to 200 joules depending on the manufacturer's instructions. After the shock, check the patient's heart rate and blood pressure again. If the heart rate remains low, continue with CPR until another round of defibrillation can be given. Remember, responding to cardiac arrests requires quick thinking and proper assessment of the patient's vital signs. With proper training and practice, you can help save many lives in emergency situations. As paramedic, you received extensive training on a variety of techniques that can help you in critical situations. However, it's not just enough to learn about these techniques. You must also be able to put them into practice when it counts. Putting learned techniques into practice is especially important in emergency situations, where seconds can mean the difference between life and death. The key is to stay calm and rely on your training. Take a moment to conduct a rapid assessment. Check a patient's responsiveness, beats per minute, blood pressure, and their pain indicator. Remember, techniques you have learned are only effective if you're able to put them in use in real-life situations. Practice, practice, practice until you're confident in your ability to use these techniques when it matters most. Congratulations, you've completed the video portion of your training. Now, turn to your instructor. They'll take you to the medical supply closet where you gather your materials and prepare to practice on some training dummies. We know you'll do great. Good luck out there, medic.
We would like to address recent speculations regarding While we are unable to provide detailed information at this time, we can confirm that the organization has undergone a significant internal review process, which has led to changes in its structure and operations. In light of this review, we want to clarify that was never employed by the law, either directly or indirectly. Any suggestions to the contrary are unfounded and lack credibility. We understand that this news may be unsettling, and we want to reassure the public that the safety and well-being of our community remains our top priority. We are committed to continue to provide the highest level of service to the citizens of Los Santos, and we appreciate your continued support and understanding as we now